I think we're surging. I think we've quadrupled our count in the last 30 days. Today we have, as of right now, we haven't got today's numbers, but using yesterday's numbers, we have 185 total confirmed. Mm-hmm. And back on May the 27th, we had 44. So we more than quadrupled in a month. And so it's definitely concerning. I don't know if you have all the numbers. We have, again, 185 confirmed. Mm-hmm. We have 72 reported recoveries. I really have no idea. You know, it could be the opening. It could be all of the marches in Houston. It could be just the virus naturally taking its course. It could be people who are not, what am I trying to say, who are loosening up on their hygiene and their distancing. Mm-hmm. I could be any of those things. I don't know. But it's definitely alarming. And it's all around us. You know, I guess it would really be shocking if it was just Wharton County, but it's all of Texas is shooting up out of control. People have got to keep their distancing. They need to wear face masks when they're in public. They need to wash their hands as often as they can. But it's a different group now. When we started, we saw a lot of clustering, a lot of family-related clusters. There was possibly a family member who was working in the healthcare industry and got contamination that way, and then went back and contaminated the rest of the family. We saw connections early with nursing homes. We also saw, I would say most of our cases, it appears that people are traveling out of the county and they're bringing it back home with them. And if they're traveling to some of our more populated counties, you gotta put your face mask on when you're in public, in large groups, and you gotta wash your hands. And what one thing that contributed to, I have no idea. We're reminding residents that they need to follow the CDC guidelines that we've stressed all along. Today we're going to have either trying to set up another public service announcement with all the leaders of the county on YouTube or whatever it is that they used before. Mm-hmm. My column this week is an update, and it's telling people what I just told you, you just have to think about not just yourself, but the other people in your family and the other people in the community. Mm-hmm. You gotta distance. If you can't distance, you gotta wear a face mask. You gotta wash your hands. You gotta use common sense. Mm-hmm. I would say we tested 300 people a week ago. Mm-hmm. 300 people. We had testing every day. Not last week, but the week before, we had testing every day. It was the first day. It was in El Campo, then Wharton, then East Bernard, then Wharton, and then El Campo again on that Friday. And I think the number was right at like 290 something that I heard. So I'm going to say 300. You hear people say, well, the numbers are going up with more testing. Well, that may be true, but the frequency is going up. When we first started testing, we saw less than 4% of those tested were positive. And now we're seeing that number of tested is getting up near double digits, near 10%. And so it's not just the testing. Of course, when you test, you're going to get more positives, but it's also indications that it's spreading. And so it's definitely something we need to be concerned about. And not at this time. The rural parts of Texas follows the governor in his strike force. His strike force is made up of the best doctors in the nation, the businessmen, and emergency management people like Nin Kidd. When he says mandatory face masks, then we need to do that. But we follow his lead, and he's reluctant right in charge of that. And then you have so many constitutional issues as far as personal freedoms and core, liberties and things that I would guess, I don't know this, but I would guess that's why the governor hasn't touched that. He's kind of pushed it down to the local government, and definitely each area is different. Harris County and Fort Bend County have millions of people, and millions of people in every square, or hundreds of people in every square mile, where we don't have that. And so all the counties are somewhat different in their makeup, but I'm not saying never, but we followed the governor throughout and took his lead, primarily because he has the experts. We don't have all those experts to rely on. But I definitely would encourage people to wear their face masks and to wash their hands and to distance when they're in public. Yes, right now all of that's done by the state. What happens, and I think I said this earlier, but the labs report the positives to the state, to the DISH, to the Department of State Health Services, and then they conduct their investigations. They call the positive individuals and ask who they've been around. The distressing thing about that is the DISH is so far behind. They're so out. They don't have enough employees, and they're so backlogged that by the time they get back to a positive, it may be 4 or 5 or 6 days later. So if you think about it, let's say if you were positive, and so the lab contacts you on Monday, and then hopefully they contact the DISH on the same day, but we hear reports that they even take 2 or 3 days to contact the state. Well, now you're 3 days off, and then the state's 7, 8, 9 days behind. And so now if that person who had a positive has been, out, well, he knows or she knows to quarantine because the lab told them, but all the people that they came into contact don't know. And so now they're out there for a whole 10 to 14 days. And so it's just kind of a mess with tracing. There definitely needs to be a better job in doing it. But from everything I hear, the state is just so backlogged and so understaffed. Well, my office and our emergency management team, and I would say all the county leaders are urging people to social distance, to wear face masks when they're in areas where they cannot social distance, and to wash your hands and just act responsibly. I don't know where the blame falls. I think it's just the natural course of this. They close bars and they stop rafting and things like that, which certainly could accelerate. But then we also have, you can watch on the news and see thousands of people gathering in Houston for whatever reason, and then we have people who travel there to work, and again, the statistics from what I'm hearing suggest that most of our cases are coming from the larger cities and being brought home. I would tell you something that is really concerning, and I think we touched on it, but our cases are more scattered now throughout the county. As I mentioned earlier, we used to see clusters, and where as I mentioned, it was a family that had been infected or contaminated. But now, lately, in the last, I would say 30 or 40 cases, there are very few relations there. And when they're not related, they refer to that as community spread. In other words, they do not have an exact contact point, like mom brought it home or something. And so the number of countywide community spread is increasing, which is very concerning because before you could at least isolate it to like if you had 15 cases, you do 7 were over here and 6 were over there. Now they're needing to be all over the county. And I'm pretty sure about this. We have 112 actives today, and of those actives, 53 are in El Campo, 33 are in Wharton, 10 in Bowling, 10 in East Bernard, 3 in Hungerford, 2 in Louise, and 1 in Glen Flora. Those are active as of today. No, I would say we probably have a lot more recoveries because if you go back, some of our cases are very old. But as I mentioned, the dish is so far behind and so backlogged in recording new cases that they're not getting to the old cases because usually, as I understand it, after 14 days, they would call you back and ask, how are you feeling and such. In the beginning, you were required to take 2 tests after you were positive. Like after 14 days, you had to receive 2 negatives. And now I don't even think they're doing that anymore just because of the overwhelming amount of cases. But I would say we probably have a lot more recovery, but we're not getting those numbers. We usually get them on Sundays. Like yesterday, I believe we picked up, I think it was 17 yesterday maybe. And so it was 16 months. Yeah, let me see. It was